The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. With us, we have an expert on the topic. We're talking about laser dentistry today. And in fact, one of the few people in the state, the only person in this county to have this new laser, Dr. Huber. Dr. Huber, welcome to the program.
Thank you, Randy. Great to be back.
All right. Now, before we get into today's topic, you are a periodontist.
Yes.
And let's talk about your practice first. What are the different, because you do more than just laser dentistry.
We do much more than just laser dentistry. Periodontics, in the literal sense, means perio is around and dont is tooth. So we really treat what's going on around the tooth. And what's going on around the tooth is gum, tissue, and bone, so soft and hard tissue. So we treat gum diseases. We also treat, that's for health.
Okay.
And we also do cosmetic procedures as well. Somebody feels their teeth perhaps are too long, or when they smile, they have too much gum showing.
Like a
we
gummy
can have gummy smile, recession, longer teeth. And another part of our practice, a large part of our practice, is replacing missing teeth with dental implants.
Dental implants.
But
we talked about no more dentures.
No more dentures. We talked about that previously.
In the future,
absolutely.
I guess.
We hope.
Okay, now with laser dentistry, and tell me a little bit about your background and training in regard to lasers. Why did you get involved? Because I know in my research for the show, not all periodontists are
not all periodontists are on board.
This laser.
No, they're not, but they will be soon.
Okay.
I've done traditional periodontics for years, as all periodontists. I've been practicing for 14 years. I did a 3-year residency and a 1-year general residency. So for about 18 years now, I've been doing traditional periodontics, much less so in the past 3 or 4 years since I've been using the laser. The traditional periodontics works. It's tried, it's true.
So it's gum disease. We're talking about gum disease.
We're talking about gum infections, gum disease.
So what is the
an infection in your
traditional
mouth.
way to get rid of gum disease? And what are you doing now with the laser?
Okay. Traditionally, a person with gum disease would go through a series of scalings or deep cleanings at usually a quarter or a half a mouth at a time. And if the gums didn't respond well to that, or if their gums were very advanced, sometimes they go directly to surgery, then they would need what's called periodontal or gum surgery. And really what that is an access procedure. It's where incisions are made around the teeth, and the gum tissue itself is pushed back. It's to gain access to the roots of the teeth and the bone, because that's where the problem really lies. You can't often see it. It's right deep down into the roots of the teeth and the bone. The area would be cleaned out, debrided. Sometimes we could add bone, reshape the bone, and then with stitches, the area would be closed up.
So you have to scrape it out.
You have to scrape it out
and remove the.
Yeah.
Okay.
And it does work, but
it's an infection. Is it an infection?
It's absolutely an infection, Randy.
Interesting.
It's one of the most common infections there is. About 80% of the population is afflicted with some sort of periodontal disease.
Really?
So it's fairly common. And
is that the number one way people lose teeth, by the way?
Absolutely. The number one reason for tooth loss in this country is because of periodontal disease, untreated periodontal disease. So, and that's not a pleasant experience. And it can be avoided and it can be controlled, especially if it's caught early. And the big problem with traditional surgery was it worked, but it wasn't the most pleasant experience for the patient or for me doing it. I knew there had to be a kinder, gentler way of doing it.
Than just cutting the gums and removing it.
Than just cutting the gums and removing it. So we go from that to the use of a laser. You know, with the use of a laser, really all we're doing is regenerating, rebuilding in a very conservative approach, as opposed to resecting.
But are you killing this infection with the laser? I mean, the heat of the laser kills the infection?
The heat, the energy, the light of the laser kills the bacteria which cause periodontal disease. It's quite remarkable. It's very, very specific. It goes into the gum pockets and kills all what we call the bad tissue and the bad guys, sparing all the healthy tissue. It's very, very selective, and it's very atraumatic. And we've been seeing some wonderful results. We always tell our patients they're going to improve. The question is to what extent. And the results have been similar, if not better.
So people could smile again. I mean, we're talking about
people can smile
having
again.
a smile. I mean, there's a lot of people that
it's more than just a smile. It's more than just aesthetic. It's health. It's periodontal diseases now have been linked to so many systemic illnesses, heart disease, respiratory disease, preterm low birth weight babies. Every day we're learning new things. It's not healthy to have chronic inflammation. It's not healthy for your immune system. Your body's constantly fighting it. When you have a very severe case, and diabetes is another big one, it's a constant stress on your body to fight this chronic infection.
Okay.
And we've seen it.
So the laser zaps it out. I'm not trying to oversimplify here, but
no, essentially that's what we're talking about, Randy. Yeah, the laser zaps out the bacteria.
It's very interesting. I'm glad we have you on the show because people always say, they always ask us for referrals, and I always say, because we don't give referrals on our website, but I say go to a specialist, go to somebody. This is all they do, and I know that there's. And I guess you're the only person in your town, or even in your county, or several counties.
Several counties. There's really only two people in the state of Vermont right now that have it.
This is an expensive laser, right? I mean, they're close to $100,000 laser.
They're slightly less than that, but it is quite. It was a big investment for our practice. There's no doubt about it, and it's one which I'm glad we did.
How has it changed what you do, by the way?
You know how it's changed how we do it? When people come back and actually say thank you. When people come back and they don't need anything more than over-the-counter medications, they don't have long teeth, they don't have sensitive teeth, and we've really stopped their bleeding, killed the bacteria. You know what? Periodontal disease in an advanced form, it can cause teeth to move, splaying of teeth. When you see people with their teeth that go forward, it's because they're losing bone, starting to flare out.
Is that right?
Yeah, longer teeth, the gum line starts going up. Bleeding teeth where they can't bite into things. Bleeding is not normal.
And that can be stopped, by the way, with this laser?
That can be arrested, absolutely.
That
can be stopped. The bleeding is stopped. It's very common. It's when you're flossing and brushing,
but isn't that
even
normal,
a little bit of blood. No, it's not normal at all. It's a sign of disease. If any other part of your body was bleeding, you'd be concerned. Okay. But for some reason, when you get blood in the mouth, I don't know if people are used to it.
But even a little bit of blood in the mouth is not good?
It's not, doesn't mean it's a disaster, but it's not good.
But what's happening? What's causing that blood? And how does the laser have anything to do with this?
It's caused by inflammation, bacteria. Bacteria are causing an insult. As a result of bacteria living in the gum lining, bacteria like to hang out in dark, moist places. And a lot of them are what we call anaerobic, or don't need oxygen to breathe. So it's a perfect environment. It's a nest, if you will, for this bacteria. Bacteria, as a result of their existence there, release byproducts called endotoxins, which are basically toxic to the body. And that starts a cascade of the body. The body wants to fight it and fight back and get rid of it. And that creates what we call the inflammatory response. And that inflammation, that chronic inflammation, is what causes the blood. And it's through the blood that the bacteria get into other parts of the body, through the blood vessels in the mouth. And it can create a cascade of other systemic problems that we talked about. The mouth is the gateway.
So the symptoms, what are the symptoms defining periodontal?
There are various symptoms around periodontal disease. You could have, the number one symptom is probably bleeding of the gums, okay? Or inflamed, red, puffy gums. You can also have teeth which are moving or splayed or loose teeth, shifting of teeth. Your smile's changing. I never had the space before. All of a sudden I'm developing a space. You could have a bad odor in your mouth, bad breath, bad taste constantly, no matter how often you brush.
So the odor is from this infection under the gum line?
Absolutely, from the bacteria underneath the gum line. Okay. And also, you could have no symptoms whatsoever. There are some people who have periodontal disease who have no symptoms, yet they have this chronic infection going on underneath their gums. So it could take one of those forms.
How could you have no symptoms and have it, is my question.
For example, with smokers, okay? A lot of people who smoke, majority of smokers have some form of periodontal disease, especially in their front teeth. And the smoking really, the effects of smoking, of the nicotine, really constricts the blood vessels and masks some of the symptoms of the bleeding. And
interesting. Okay.
Every time, an assistant comes to, one of my office staff comes to get me, and we've got a younger person, and I see somebody in their 30s or 40s, and they're there for periodontal disease, the infection, the chronic bacterial disease. 50, 60, 70% of the time in the younger generation, we know that they're smokers.
Is that right?
It's that common. It's the number one risk factor for developing gum disease right now, as well as a host of other problems, which we're all aware of, is smoking. But the number one risk factor is smoking.
And they don't get that. It's very interesting. Okay, so they don't bleed.
They won't bleed because the constricted blood vessels. It'll mask it. And there are also just some people who don't show any or don't demonstrate any signs of the infection, yet they do have it. And the only way it can be really diagnosed is by a proper set of radiographs or x-rays at the dentist or in our office, and a full mouth of charting or probing, what we call it, where they measure the gum pockets. So when your dentist or hygienist is going around your mouth measuring, that's what they're doing. They're screening for periodontal disease.
Now we should mention this because we're talking about lasers. Instead of surgery, or instead of cutting, I should say.
An alternative form, yeah.
Lasers to treat gum disease. Okay, so in the old days, not too long ago before you had this laser. And by the way, this is FDA approved?
It's an FDA approved procedure. It's the only laser which is FDA approved.
For the treatment of gum disease?
Yeah, because there's for the treatment of gum disease.
I talked to a general dentist talking about, I told him you were going to come on the show.
Sure.
He says, it's amazing. We do a cleaning, we do this, we do that. We tell them, you have gum disease. You have these 4mm pockets or 6mm pockets, and they almost ignore it, like they don't want to do anything about it. And so what do you tell a patient that's been told they have these pockets, I guess, around their...
I mean,
how bad is that, I guess?
It's bad. It's terrible. Yet the problem is why these patients don't take it, say, seriously, if you will, is because often it doesn't hurt. And they may think a little bit of bleeding is normal. The problem is when it actually hurts, Randy, sometimes we can't help them then. It's like the earlier they get treatment, the more predictable and more favorable the outcome will be. So the idea is, I mean, nobody is born with advanced disease. Okay. It progresses into that.
And back to this general dentist, he was saying, they almost feel like we're trying to sell them something, and they actually have gum disease.
Because it doesn't hurt, and they can't see it.
So they put
believe
it
me,
off.
if they woke up one day with an infection on their hand, like gum diseases, and it started bleeding, and their skin was getting loose, they wouldn't walk around like that. They'd probably put a glove on and head directly to their doctor and demand to be seen that day. Yet it's in their mouth, and they may not realize that they have it, and they don't see it, and it doesn't hurt. So sometimes, it's difficult when somebody comes in and we have to explain to them what's going on. But that's what we do. We have to educate them and explain to them and tell them that this should be taken seriously, because who wants to lose teeth? Losing teeth is one of the most dreadful things. We feel so bad for our patients when they come in and it's too late to tell somebody that it's too late, we can't help you. It's difficult.
Is this
really
true?
is difficult.
In the old days, because I know you still do the surgery depending on how advanced it is. You told me.
Well, it's not really how advanced it is. There's certain situations when we're still doing traditional surgery because we have to sometimes see what's happening underneath the gums.
I see.
There are certain indications for it, but by far and large, 70–80% of the people that we treat are going to benefit from the laser.
And early detection, like anything else, is the way to go.
Early detection, like anything else.
So if you're starting to get bleeding gums, go in, get zapped.
Absolutely. Well, get an evaluation, maybe zap. Yeah, and it's that easy. It really is, and it's painless. It's virtually painless.
In the future, would you say that because if everybody in the world loses their teeth, aside from accidents, from gum disease,
sure,
okay, it's this chronic infection. In the future, do you think regular checkups, they'll go around the mouth with a laser? 20 years in the future.
No, not regular check. Yeah, as a preventative maintenance measure, sure. Listen, we're fighting bacteria. Why not use everything in our power to win that battle? And the laser is a very atraumatic, effective way of killing bacteria. And it's the bacteria that cause periodontal disease. I mean, it's just so logical. You're going to see more and more people using it. It's being embraced. I mean, like it's change. We're sort of. It's a paradigm shift for periodontists. As periodontists, we're trained to do traditional surgery. That's what we went to school for. That's what we're used to. And change in anything, Randy, as you know, it can be difficult to accept. But what's interesting, speaking to the manufacturer, is the majority of new people using and buying the lasers are periodontists.
Is that right?
It's catching on. It really is. They're talking more and more about it.
But you guys resisted it.
Sure,
you said
it's change.
At the beginning. Even you resisted it.
Even I resisted it. But
you just thought it just didn't work. Is that right?
I was very skeptical until I spoke with colleagues who have used it. I went down with 5 other periodontists to get trained. It's a 5-day training program, and the conditions were that if we didn't like the laser, we could return it. Not one of us returned it.
Is that right? Yeah. I had a periodontist tell me one time. She said, Randy, gum disease is not a sexy procedure. It is. You didn't even want to call the patient back the next day. Now with the laser, she said, it's unbelievable.
It's completely different now.
Do you feel the same way?
I wish I could bring some staff members here and talk to us here, because the difference that we see in the patients that we treat the laser versus the non-laser, it's remarkable. You don't have the sensitivity. You don't have the long teeth. There's huge aesthetic concerns sometimes. You don't have food trapping between the teeth. When you do resective or taking away treatment, it works, but it's functional, but it leaves the patient in a somewhat compromised situation.
So when food gets trapped in the teeth, that's because why?
Between the teeth, because when you're doing it the traditional way, you're taking away gum tissue and you're losing some gum tissue.
Interesting. Okay.
And you create little spaces between the teeth. And that can either A, be unsightly, B, sensitive, or C, trap food, or all of the above. We just don't see that with the laser. It's remarkable. The gum
And
line,
how,
the gum
for
line
hot and
doesn't
cold
change.
sensitivity caused by some of these things, how soon can that go away?
Days after the procedure.
Is that
the
right?
bleeding, days after the procedure. It's remarkable how quickly it heals. Lasers are being used now, not just in dentistry, all over medicine. It's the future. It's here. And I'm glad I embraced
because
it.
if you're calling it an infection, like anything else, when you have an
Most
infection.
certainly an infection. Not only is it an infection, Randy, it's communicable.
You could
Meaning
catch it.
You could pass it on.
By kissing.
Intimacy.
Is that right?
Absolutely.
Are there study research?
Absolutely.
Really?
Yeah.
Is that right?
It should be taken seriously.
When you have a flu or you have a cold, your body, it robs you of some energy because your body. Do people feel better? I'm just curious. Do people feel better when you get rid of the infection?
In advanced cases, yes. If you have mild to moderate periodontal disease and you treat that infection, which is where you should be treated if it's picked up early, which is great, you may not notice it as much as somebody with a severe advanced infection. With serious bone loss, perhaps losing a couple of teeth, very red, raw bleeding gums, they will most certainly notice a difference in their energy level. You know what's remarkable? We treated recently a diabetic patient on insulin in the office. And within weeks of the treatment, he started to notice less dependence on the insulin. It's very well documented, the interrelationship between diabetes and periodontal disease and vice versa. If one's out of control, then the other will be out of control.
I have medical
They're both
doctors.
interrelated.
I have medical doctors that come on the show and they say that they look at the patient's mouth, and if the patient, it looks
it's a
like they have
pathway
dental
for bacteria.
problems.
When somebody goes in for knee transplants or heart transplants or serious procedures, they need a dental screening prior to performing the procedure. The bad infected teeth need to be taken out. Why? It's a source of infection for the entire body. After the procedure,
if you have an infection in your mouth, you probably have other problems going on inside your body as well.
Absolutely, and it travels. Like I said, it just doesn't stay in the mouth. It's not localized. It goes through the blood vessels into all parts of the body. It's very well documented now.
What's your favorite thing about this laser when it comes to gum disease? Like, what do you see in patients that excites you?
They come back and they're happy and they thank you. And it's a kinder, gentler way of doing what traditional surgery did for years. It's a pleasure.
So
really
70–80% of the gum disease you treat
is treated by the laser now.
Do patients know they have gum disease? Do they call it periodontal disease? Do they call it gum disease? Are those the same thing?
It's the same thing. It's the same thing. They're synonyms. Some patients know that they have it and avoid it, and others don't. But a lot of people don't realize they have gum disease at all.
So they can call you directly. I mean, they don't have. I mean, they could talk to their general dentist about it, which is what you recommend.
We recommend them talking to their
general. Could they call you directly if they have symptoms that we're talking about?
We get patients who call us directly.
So they can.
They certainly can. The vast majority of come by referral from their general dentist, but we don't have to. They don't have to. We work in partnerships with the dentist. If they don't have a dentist, we'd be happy to refer them one. We can't handle all of their dental needs.
People don't like going to the dentist, especially
if they have gum disease. They don't like being told. They avoid the situation. They're embarrassed. Sometimes people come in, they hadn't been to the dentist in years, and they just don't feel good about themselves. They don't want to meet a stranger and open up to them, but they need to realize that there is help.
We're going to take a quick break. We come back, more about, you brought some photos, and more about the importance of a smile, because you think it's pretty important. But even though you're a dentist,
I'm a dentist. Of course it's important, Randy.
Right? You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back.
The thing that absolutely amazes me about this practice is that I've been coming here for about 2 years, and I actually thought I was going to lose all my teeth. I brush twice a day, I floss, I use a water pick, and I still was going to lose my teeth because I had gum disease. And the prognosis for as long as I continue my routine and taking care of them, I have my teeth for the rest of my life. And that is, for me, absolutely phenomenal.
I received laser treatment on my upper teeth and gums. And that treatment was very painless, honestly. It was not very painful at all.
I traveled 2 hours to come here and get the surgery done. My advice is don't wait. I've had an excellent result. It's a year out. And my bone has regrown, and I'm very, very happy with it. If I was given the choice of having it done again, I would definitely do it. Get it behind you and be happy with your smile.
You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthrough treatment options for people with gum disease. With us, we have an expert on the topic, periodontist Dr. Huber. Okay, Dr. Huber. Now, we were talking about, you say, Randy, I don't want to forget that the most important thing here is not about getting rid of the gum disease, it's about getting people to smile again. And I'm paraphrasing you a little bit.
Yeah, we were talking at the break. Smiling is so important. Like it or not, in today's society, there's a high emphasis on aesthetics. And when your smile's off, you're not confident of your smile, you're guarding your smile, you're putting your hand over your mouth, you're embarrassed, you're shy, that right away says something about you. Now, you may not agree with it, you may not like it, but that's, in today's society, that's what's going on. You look at magazines and pictures, you're just seeing beautiful smiles, beautiful people, beautiful teeth.
People that smile,
they smile. It opens doors. I mean, do you want to go somewhere where someone's not smiling? I mean, how do you respond to it? You sort of react the same way. If somebody's not smiling, you're going to be mean to them back, sort of. But the reason they're not smiling may be because they're just, not that they're mean or unfriendly, it's just that they're hiding something, they're guarding. It's amazing. Adaptation, what people learn to keep their lip down because they don't want their gums to show, or they're afraid to smile because they smile too high and they show their big gummy smile, and they're embarrassed about that. So it's
lasers
interesting.
fix that too.
They can. They can reshape the.
People, by the way, you treat with a laser, and now they come back and they're smiling at your front desk, and you see that?
We see people. Yes, I mean, extreme example. We see people crying sometimes at the consult and coming back and giving us hugs and smiling. I'll show you a photo, a good example. This poor gal.
All right.
Young gal came to the office, maybe late 20s, early 30s. Don't remember her exact age. Very depressed. We're looking at puffy, bleeding, red gums. I mean, you look at the picture, it's almost bleeding as we're talking. Every time they bite into something, okay, it's embarrassing. Imagine going out to eat or biting an apple and seeing blood on the apple.
Does that
or
really
being
happen?
afraid. Oh, it really does happen. Spontaneous bleeding.
Okay.
Absolutely. And it definitely, we're talking about advanced cases, okay? And after the laser treatment, a couple weeks later, what a difference in this person. They came back, they were glowing, smiling, happy. It's like they bloomed, their personality changed, no more bleeding. And so quickly, I mean, what a response. It's tremendous. It's so gratifying. Your smile's like your calling card. When you meet somebody, that's the first thing. You smile and say, hi, how are you? Especially, in
a tough economy, though, on a job interview, you hire the person that's smiling.
No doubt about it.
Equal, obviously.
Of course. You want somebody friendly, upbeat, positive. I mean, nobody wants to be around depressed people. And that's part of your smile. That's what people, they look into your soul through your eyes and your mouth. I mean, that's who they judge who you are. So it's very important. And as dentists, we take our smile seriously. So,
all right. Okay. Well, that's good for you. Good for you.
We have some other examples. Here's somebody, again, with very long teeth. Very embarrassed when they smile. Sensitive teeth.
So when they say long in the tooth, is that what they're talking about?
That's part of the symptoms of long in the tooth. But this, Randy, this was caused by not only, no, it's not an illusion. The teeth are longer. Why are they longer? The gum line is receded up or down.
Is that from brushing too much?
Exactly.
Is that
aggressive toothbrushing? Very aggressive toothbrushing causing exposed roots and extreme sensitivity. We can help people like this. Doing a periodontal procedure.
Those are the same gums.
Those are the same gums, but they had what's called grafting done, where we take tissue and we cover over the exposed roots. Changes their smile, reduces the sensitivity significantly. Yeah, it's like when you drink something. A lot of people have to wait till it gets to room temperature, really. Otherwise, it would just, sort of give them a zing or a shock. That's not normal. Getting these zings or shocks when you eat. I mean, the mouth is supposed to be comfortable. You're not supposed to know it's there. You're not supposed to guard it. You're not supposed to go to a restaurant and order certain foods because that's what you can eat or can't eat. You should order it because that's what you want. It's important for a healthy body and a healthy mind to have a healthy smile. Absolutely.
Okay, good. Now, we probably have time for just one more photo. We're talking about, and if they're just tuning in, we're talking to Dr. Huber, periodontist, one of the only people, of course, the only person in his county with this new laser, FDA approved to treat gum disease, bleeding gums, red puffy gums, bad breath, things like that. Literally zapping out the infection, right?
Zapping out the infection with the use of laser. We kill the bacteria. Let me walk you through the process. I mean, it's very simple. We generally do it in 1 or 2 visits. People come in. We usually use local anesthetic, so they're comfortable. If someone's very anxious, we can give them some pills to take, some oral sedation, so that they're not really aware of what's going on. We have laughing gas or nitrous oxide, televisions on the ceiling for, if they want to watch television during the procedure. And there's not a lot of noises, there's not a lot of rough, it's not a very, not a very traumatic experience for the patient at all. Literally, they take a little wand, if you will, and go in and around the gum pockets, and what this laser, the light does, the initial pass, is it just kills the bacteria and opens up the pocket, if you will, the gum pocket a little bit. We then clean it out with an ultrasonic scaler with an antibacterial solution. And then we use the same wand on the laser at a different setting, okay? And that setting is create a blood clot. It seals the gum pocket so that the gum lining is separate from the oral cavity. In the mouth, there's a lot of bacteria no matter what we do. But inside the gum pocket is where we want to prevent it, and what that does is seal it up. So it's the patients, we call them always the next day, say how they're doing.
So the gums get healthy.
The gums get healthier.
What about loose teeth, like slightly loose teeth? Do they get
slightly
firm
loose
again?
teeth get firmer, and if they're really loose, we bond them or splint them together, put a little wire behind them, and it really helps the healing.
Laser dentistry.
It's honestly true. It's a breakthrough. It's a paradigm shift. It's definitely the future, if not here now. It is in our practice. And it's a much kinder, gentler way of treating periodontal disease.
So if you don't like your smile because of some of the things we've talked about,
see your dentist.
Get in there.
Come on into our office. See your general dentist. And what's very important, Randy, which isn't stressed enough, no matter what we do in our office, it's a partnership between us, their dentist, and the patient. They have to take personal responsibility with good home care.
Okay.
Just as important.
But somebody watching this, because there will be people that say, he doesn't know my mouth. I have the worst gums, the worst.
As I said, the worse you are, the more dramatic the result. It's possible, sure, absolutely. We can't save every tooth.
You may have to extract the tooth.
We may have to extract some teeth if they're too far gone, but don't assume that. Come on in and get evaluated.
Are people surprised? I mean, do they come in and say, this is the worst you've ever seen? I guarantee, doctor.
Yeah, yes. I mean, we see a lot. And sometimes it is too late, to be frank. We can't save every tooth, like I said, but we can help a lot of people. And don't make that assumption on your own. Come on in and have an evaluation.
But if the tooth has to be pulled, they should get it pulled, right? Because that's creating a lot of infection.
Absolutely. You're not doing yourself any favors for a number of reasons. Because if you're losing bone, and it's a chronic infection, and if it's hopeless, then we have to deal with it. And the more bone you lose by postponing it.
So when you remove that tooth, the infection goes away?
Correct.
Because this bacteria lives on the tooth root?
Exactly, around the teeth.
Interesting.
Yes.
Okay, good. Final message. Bleeding gums, all that. Maybe they're still skeptical, or they're afraid of the dentist. You offer sedation, those kind of things. What's your final? Where do they get started? Just give you a call?
Give us a call. Call if you have a dentist. Call your general dentist. Call our office. Check out our website. Gum disease is treatable, and you should take it seriously. It has other effects besides the mouth, and nobody wants to lose teeth. And don't wait till it gets too far along till you have to lose a tooth, because it's not the most pleasant experience.
Okay, good one. Thank you for coming to the show. Great stuff.
Randy.
Great information.
To be here. Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. Put in Dr. Huber's name or gum disease or laser dentistry, and you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.